Hi everyone, I'm Camilla, and from my Chemistry and Me topic, as you may have seen on the forum, I've decided to do a little presentation on how painkillers work. Well, it might be interesting since most of us have probably taken a painkiller at some point in our lives, although I'm sure most of us don't really have any idea how it actually works. Of course, if you happen to be in one of Mayland's healthcare programs, you might find it even a bit more interesting. It's a pretty big topic, so we'll only be able to scratch the surface within 8 minutes. Of course, that might be a good thing considering how detailed the topic can get into. So if we're to understand how painkillers work, it's probably a good idea to go through what pain itself is first. Pain is basically our body's way of telling us that something somewhere is wrong. There are four main types. There's regular tissue pain, so if you were to prick your finger or cut yourself, this would be that kind of pain. There's inflammatory pain, so if you have a infected, inflamed area of the body, like with arthritis, which is based off inflammation, that would count as the inflammatory pain. There's also neuropathic, which basically is pain that arrives within the nerves itself rather than being detected in tissue layers. And there's also functional pain. So that's without any obvious origin, like perhaps Crohn's disease. We don't exactly know what's causing the pain, just that it's a part of some other condition. So for any of you who've taken a biology class recently, these two pictures probably look somewhat familiar to you. Over here we've got the central nervous system and the peripheral nervous system, and this system is basically how we perceive pain and how we sense it. So most of the time it will be perceived from the nerve endings, and then that message will be sent, well, through the nerve all the way to the brain. Occasionally it will be sometimes within the nerve, like the neuropathic pain, or sometimes within the brain itself. And also here is a nerve cell. These are how they transfer all the messages all the way to the brain and back. So you've got the dendrites over here, the axons, and the neurotransmitters are set from one axon onto the dendrites, and messages sent all the way through impulses and through the axon to another nerve cell right here, through the dendrites. Now, not all types of pain are treated the same way. So depending on what kind of painkiller you're given or any other method to treat the pain, it depends on where the pain is, what's causing it, how severe it is. And if you go into any kind of appointment these days, as well as having your temperature and your blood pressure and other vitals taken, some places will ask you how much pain you're in on a scale of 1 to 10, with at the end of the scale 0 or 1 being no pain, you're feeling absolutely fine, and on the opposite end of the scale, 10 being the worst pain you could possibly imagine. Although if you're actually on a full 10, you probably didn't hear the question in the first place, so I'm not sure how they really answer. And in most cases, mild and moderate pain are treated fairly differently to how very severe and awful pain would be. In terms of medication, there are quite a few different types out there, but these are the main kinds. You get non-steroidal anti-inflammatory drugs, so ibuprofen, naproxen, or as you might know, Advil. That would fall into that class. There's acetaminophen or Tylenol, also known as paracetamol, which works slightly differently but is over the counter like ibuprofen and that. You also get topical analgesics, so lidocaine and anything that you can put on the skin rather than ingesting it. Or you do sometimes get lidocaine as eye drops, which also counts as being topical. Anticonvulsants, so this is better for, say, nerve damage, gabapentin. It works rather differently from the other ones that have been mentioned so far. And of course, there's opioids, which have become rather infamous lately due to high rates of addiction, and they're used in strong cases, not for mild to moderate pain, really. Now, apart from Tylenol, it's probably these types of medications that most of us are quite familiar with, because they're most available over the counter. So ibuprofen, naproxen, aspirin, these are all in this category right here. You also get some prescription ones like meloxicam or, Celebrex. I've forgotten how to pronounce the generic one. And of course, high doses of ibuprofen can also be given as prescription. This is because they tend to have more side effects than the over-the-counter versions, and so they prefer supervision from a doctor or another kind of medical professional. They work really well against pain and inflammation, hence why they're called anti-inflammatories, and they're usually used for mild to moderate pain rather than anything too severe. Here's a quick look at the mechanism of action, which I'll go through quickly because I'm running out of time already. It inhibits this production right here, so it as well as inhibiting pain and fever and inflammation, it also inhibits protection of the stomach lining, which is why sometimes it leads to stomach ulcers. Now, acetaminophen, or paracetamol as I called it growing up, is probably the most popular medication used in this country and is greatly popular worldwide for a good reason. Although used in high doses, it can cause problems to your liver. It's hepatotoxic. It is often used in combination with other medications because it uses a different biochemical pathway. So you can take it every now and again with your ibuprofen. It's usually combined with the opioid medications. So hydrocodone is usually found with a typical dose of Tylenol along with it. Now here is the chemical structure of acetaminophen. The active site is over in this region, which binds to cyclooxygenase, which is shown right about here. And this is how it prevents the development of fever and prevents pain from being perceived by the brain. Now, for neuropathic pain, or pain that originates in the nerves themselves, common one is gabapentin, or sometimes Lyrica, which can treat these. They're classified as being anticonvulsants, and they're often used to treat conditions such as shingles, which is shooting pains of the nerves, diabetic neuropathy, where diabetes has degenerated the nerves somewhat. And if we go to the next page, I'll show you how it works. And this is how gabapentin works. It goes right between the synaptic gap in nerves to stop the pain being transmitted. So as you can see, it will bind to the receptors so that the neurotransmitters can't bind themselves to the receptors, and preventing pain in that way. And sometimes it can cause a bit of numbness for this reason. Now, the last class of painkillers that I want to go through real quick are the opioids, and they're usually used to treat moderate to severe pain. And over here, they're prescription only, I do believe. It's different in the UK where I'm from. Sometimes the pharmacist can give you like a mild opioid medication, say if you have a migraine or a toothache. Over here, you have to have usually a medical doctor's prescription for it, or a nurse practitioner, or someone of that level, which may be the best thing for this country considering just the scale of the epidemic that we're going through right now. It is gradually getting worse in the UK as well, which may be because of the more relaxed rules. And these medications, they don't really stop pain, but they make you less aware of it. It makes you bother. It dulls the pain to a level that more people can tolerate. And it should be noteworthy that if you do take too much, it can cause you to stop breathing, which is also why they do need to be taken with supervision of a medical professional. Thankfully, we've now got Narcan, which is a medication used usually as an inhaler, or it can be given as a shot, which reverses the effects of opioids. So if someone's going through a respiratory distress episode where they can't breathe, if they're given this medication, it should temporarily relieve their symptoms until an ambulance can arrive. This is how opioids generally work. They'll bind to the opioid receptors, which is what dulls the pain sensation. Also, it dulls other sensations as well, which is why it's probably not a good idea to combine with alcohol or operate any heavy machinery all drive while you're taking some hydrocodone or anything similar to that. Otherwise, it can cause accidents because you're not fully aware of what's going on. The longer someone's on this kind of medication, the more tolerance they tend to have. This is thought maybe because more opioid receptors gradually become apparent on the end of the nerve after you've been taking opioids for some time. So it takes a greater dose to get the same level of pain alleviation or the same feeling. Well, thank you very much for getting this far, and I hope you enjoyed it. Hopefully some of you've learned something new, and if you want to read further on it or watch some videos, I've got some sources here that I use to get my own information. And if you didn't, well, it's over now, and you'll never have to go through it again. I wish everyone a happy holiday, and good luck for the rest of the semester.